admirable trend in all fields of healthcare and is encouraged by the state and federal DHHS. My greatest concern is that Davita has dismissed or fired vulnerable and sometimes harmed patients from their clinics without cause or notice in the past. Research into the rules for dismissals revealed that patients should never be dismissed from dialysis clinics unless there is a violent or threatening behavior from the patient. I have spoken to several patients that have been both harmed and dismissed by Davita. In Maine, a dismissal would either cause death or a very long and exhausting commute for dialysis patients 3 times a week. We are a large state geographically, and there are no other dialysis clinics across town in Lincoln, Bangor, or elsewhere. Some of the patients I spoke with were not only dismissed, but they were also blackballed from other dialysis clinics and services. Some were labeled as non-compliant or crazy. Some patients had to wait until they got so sick from lack of dialysis treatment that their local hospital admitted them for a couple of days to dialyze them as inpatients. Some patients did this repeatedly for weeks before they were accepted into another non-Davita dialysis clinic. If Davita takes over EMMC dialysis services and patients get dismissed, it is possible that these patients would not even have the option of going to EMMC for inpatient dialysis because Davita also plans to purchase the inpatient dialysis services from EMMC. If a Davita patient does not get a satisfactory result or response after a grievance or complaint about safety issues, complications, poor technique, or staff, the complaint process within and beyond the clinic is complex and ineffective in many cases. It is likely there will be no local board of directors to forward complaints to. If a complaint reaches CMS and an inspection is done, the clinics are generally forewarned about the inspections and the problems may be fixed before the inspection. If the clinic does not pass inspection, CMS will make recommendations for changes. CMS means Centers for Medicare Services. Although I'm sure everybody in this room knows what I'm talking about. If Davita does not comply, there are no sanctions or punishments. In a nutshell, Davita can harm a patient, and if they complain, first they get a runaround, and then there is no accountability. There is no quick fix for patients who complain and who may be suffering from substandard care. Finally, if the Davita clinic does not like the patient anymore because they have asserted themselves regarding their own care, they may dismiss them. About 90% of all dialysis patients are Medicare patients. All dialysis patients need their treatments to live and extend life, and this makes them a captive, at times frightened and vulnerable patient population. Davita makes almost all of its profits from taxpayers' dollars, Medicare, in other words, that are paid to them for the care of patients. So essentially the patients become cash cows for the corporation. Another way to look at this is that the actual dialysis patients, real, suffering, living, breathing human beings, are sold to Davita if this sale goes through. I have learned that Davita may cheapen care to improve profit. None of this bodes well for patients. I have voluntarily worked to improve patient safety for 3 years. My father was a victim of unsafe care. He became infected with MRSA in his rural Maine hospital and died as a result of that. Since his death, I've dedicated my time and energy to the patient safety campaign across this country. My focus has been on hospital-acquired infections, and I also advocate for patients. This sale of EMMC dialysis to Davita makes me worry about patient safety on a whole new, different level. I truly believe that patients would be put in harm's way if Davita Corporation, based in Colorado, buys dialysis services. They have outside control and inside purchasing, which they describe to you with their pharmaceutical business. They will deliver their drugs right to the patients and encourage them to buy them. In other areas of the U.S., they've expanded their grasp on the healthcare dollar by buying up nursing homes and other facilities. Maine dialysis patients and citizens may be harmed, and we will gain nothing for our own state or local economy if they come to Maine. EMMC already has a fine dialysis service, and I really don't understand why they're doing this. We don't need Davita. Mainers are a sharp and tough breed. We welcome business into our state, but when we put up the fight of a lifetime, that business will harm our citizens or our environment. We expect and want the best for our citizens, including safe, high-quality, patient-centered care. In just a few weeks, 3 strong patient advocates for dialysis patients, Arlene Mullen-Tinker, Carl Ginsberg, and possibly Paul Bramlett, will come to Maine to inform Mainers about Davita. They will have a public meeting and they will bring documents and patient stories. I look forward to the next public hearing about this certificate of need. In the meantime, it is very important for Northern Mainers to learn all the facts about Davita before approving and inviting them into our state to care for some of our sickest patients. I've also brought a letter from a patient. Okay, to read. It's quick. This is just a very quick.
Why didn't you just submit it to the department?
Why can't we hear it?
Pardon me?
Why can't we hear it?
Well, it's a public document. You could ask for it.
I'll submit it, but I'd like to read it too and show you a photo.
Can I ask, just to be fair, would you want to respond to anything?
Well, it's almost impossible to respond because, to the extent she's talking about specific patients, we don't know who they are in the first case, so it's hard to do that. Well, let me stop.
Sure.
To the extent that there are specific patients, we can't talk about them because of confidentiality rules. And so it's almost impossible to respond. Actually, there were a few questions in there that we can respond to, but by and large, I'm not sure we can respond to it.
There's a few things. I think there's a few things we probably want to address.